Hi everyone, my name is Sam Logan and I'm a graduate student at the University of Illinois Chicago College of Nursing, and today I'm going to be talking about the interpersonal theory in nursing developed by Hildegard Peplau. The purpose of the theory is to improve relations between nurses and patients. The construct that we'll focus on is the phases of nurse-patient relationship. There are 4 phases: orientation, which is when the nurse and patient meet; identification, which is when the patient realizes the relationship is beneficial; exploitation, which is when the patient feels comfortable using all of the nursing resources; and finally, resolution, when the patient no longer needs nursing staff. The concepts we'll focus on today are needs, interference, opposing goals, and unexplained discomfort. Needs. Everyone has them. They're either instinctual or acquired, like the need for warmth, the need to be listened to, the need to eat, the need to feel loved. When immediate needs are met, more complex needs arise. And Peplau says that needs create tension, and our behavior aims to reduce that tension. She also says that sometimes one need is more important, and a person will direct all of their behavior to resolve that need, but may ignore the others. Interference is defined as the blocking of or barrier to a need, drive, or desired goal due to conflicting values or physiological dysfunction. Peplau also says that frustration and aggression are often products of interference. There are 3 responses that patients usually experience during repeated frustrations. They may become more dependent than they previously were. They may overcompensate for the feeling of dependency by embellishing their previous patterns of independence, or they may deny the sickness altogether. Peplau says that nurses can facilitate healthy digestion of frustration by helping patients change their goals to something more achievable, and also allow patients to communicate their aggression. Third, opposing goals refers to when someone has 2 goals that are in conflict and affect their behavior. Peplau says that you can tell when a patient is dealing with opposing goals when they hesitate, vacillate, or are unable to decide on a course of action. The best example I read about was a mother who had had a mastectomy. She's in the hospital and is eager to get home and take care of her child, but needs more time to recover. Peplau says in this situation, nurses really just need to listen. The patient will use you as a sounding board, and Peplau says you should not give your interpretation of the situation, as it is often perceived as a barrier by the patient. Peplau also says don't be surprised if the patient uses a fixed response. The patient may say, "Women have to have breasts. That's what makes a woman a woman." This is because the woman cannot abandon her 2 goals, and she can't vary her 2 goals. Unexplained discomfort is manifested as needs, anxiety, frustration, and conflict. Peplau says that when feelings regarding illness are not permitted to be properly expressed, the feelings become dissociated and begin to operate outside of the awareness and outside of the control of the individual. She says that the development of awareness of future and present goals with relation to the limitations of the illness is an activity that requires energy, and that planning activities that help achieve future and present goals converts that energy into productive functioning. So how do these relate to the concept? Peplau says that these moments can be barriers to the patient from moving forward to the next stage, but also points out that it's necessary for patients to satisfy one stage before moving on to the next. So where are these theories used? The theory was intended to improve relations between nurses and patients in the clinical setting, but Peplau also puts a lot of emphasis on applying this theory to the professor and student relationship. Finally, Peplau says that in every contact with another human being, there is a possibility for the nurse to work towards a common understanding and goal. The strengths of this theory are its applicability and that it's essential to a strong nurse-patient relationship. Its limitations, though, are that personal space is not considered, health promotion is not emphasized, and it's difficult to use this theory with a patient who does not feel a need. The first study I looked at aimed to assess whether or not Peplau's theory fit into the course of a nurse-client relationship developed as it naturally occurs in home visit. The researchers found that Peplau's theory of interpersonal relations was reflective of relationship development during visiting the home. The second study aimed to describe the phases and the steps of experimental teaching of the concept of anxiety to patients. And research here identified 3 phases: orientation, concept teaching, and evaluation. Thank you for listening to my presentation. Here are my references. If you have any questions, I would love to take them via email. Thank you again for listening.